Hey guys, hope everyone's having a good week so far. My name is Shauna Cowdrey, and this is my blog 3 post. After completing the leadership skills questionnaire, it turns out that I scored very high in interpersonal skills and only high in administrative skills and conceptual skills. Um, as far as my interpersonal skills, this is the people skills one. You've got to be socially perceptive and be able to handle conflicts well. Um, it's also important with these skills that we understand that everyone is different and we all work in different ways. Um, in addition, included with interpersonal skills is emotional intelligence. This is where we try to understand our staff members' lives and show empathy and make sure we understand what they're going through every day that may affect the way they're working. Um, it's very important that we have people skills to work effectively with them so we can achieve goals. Um, the areas of improvement, administrative skills, this includes carrying out the mission of the organization and goals and managing people and resources. This includes the planning, organizing work, and coordinating different activities. Conceptual skills, this will include more problem solving and creating visions and assisting our team to accomplish their goals. Um, all of these skills are very important because they help us to build relationships with our staff members and peers and help us work with them to complete tasks at hand. Um, to secure needed resources such as staff, I will definitely need to utilize planning. Planning seems to be the most important aspect of being a manager to ensure everything runs smoothly. Um, During my planning as a nurse manager, I will analyze different situations and try to identify different problems that might arise before they happen. I will also need to focus my attention on goals and objectives. This will assist with any confusion or uncertainty with achieving our goals. And I can also plan by facilitating control. As far as organizing, I would utilize horizontal differentiation. This is where I would form different groups and make sure that everyone's on the same page in order to accomplish goals simultaneously. As far as staffing, which is also very important as a nurse manager, um, I must make sure there is adequate staff and appropriate nurse-patient ratios to make sure our patients are receiving the best, safest, high-quality care. In addition, when hiring employees or making scheduling, I would need to make sure I have a wide variety of experience and educational background. Um, Directing is another aspect that I would need to secure staff. And this is where I would present the plan to all of my staff members, make sure they understand what's going on. I will also need to supervise the work that's being done and make sure it's being done appropriately. I will also be there to assist with difficulties and issues. And lastly, I will be able to provide motivational incentives, and I also need to communicate effectively. As a nurse manager, a few goals that I would need to set for myself, including coordinating the accomplishing of goals in the organization as a whole. I will need to maintain quality patient care with staffing while adhering to financial implications, and that goes back to staffing. I need to make sure that for however many patients I have an adequate amount of staff, and I'm not going over the budget. This will also help with if we're overstaffed, seeing if any units in the division need more staffing or if we're shorthanded, reaching out and seeing if anyone has any extra nurses they can give us. Also, as a nurse manager, when change occurs, as of course it will, I need to make sure that I'm prepared. If I'm going to make a change, I need to ensure my staff knows all the change steps that are going to be happening, and just so they understand and to avoid pushback or any conflicts that may occur. How would I use the published literature in the process? I would use published literature in the process by locating evidence-based practice to make sure our patients are receiving the absolute best care possible. I found an article and it's entitled Collaborative Transdisciplinary Team Approach for Dementia Care. This goes in to discuss how Alzheimer's disease and dementia places a very huge impact on and burden on patients, caregivers, family, friends, and even healthcare delivery systems. Because of this, the study was done to try to find a better approach to caring for these patients, and it proves that the transdisciplinary team approach is the best way to care for these patients. These kind of care models are team-based, multi-component interventions that provide a strategy to deliver integrated healthcare to these patients with Alzheimer's or dementia. Quality care is integrated. There's health promotion and preventative services, and this also can reduce some of the impact on these patients and their families. After completing this study, they looked at several collaborative care models with transdisciplinary team approach, and the evidence shows that there's actually improved patient and family-centered outcomes. There's quality indicators of care and potential cost savings. Identify the levels and departments that I would need to work with in order to be effective in my role. Of course, my staff and peers would be most important that I would need to work with to be effective as a nurse manager. I would also need to work with administrative services. This includes hospital administration, CEOs, vice presidents, department heads. They all oversee the budget and finance, so I will, of course, need to know what my budgets are. They also pretty much run the hospital. They're involved in public relations, and they establish hospital policies and procedures, which is, of course, also very important for every unit. After administrative, it kind of branches off into informational, therapeutic, diagnostic, and support services, and I will, of course, need to communicate with all of them. Informational services includes admissions, billing, medical records, health education, and human resources for our staff. Therapeutic services, they will be providing treatments for our patients. This includes physical therapy, occupational therapy, respiratory therapy, any mental health, social work, pharmacy, dietary, and of course, as wonderful nurses. Diagnostic services, they will be determining the cause of injuries that occur to our patients, and this would include lab imaging like CT and X-ray. In the emergency room, in fact, they provide emergency diagnoses. And lastly, support services for the entire hospital. That would include like central supply, biomed, housekeeping, and maintenance. If I have a preference for a vertical horizontal structure, I actually looked at my organization's organizational structure, and they actually utilize horizontal, which is what I would prefer, as well as team nursing. In horizontal organizational structure, there seems to be a less defined chain of command. Everyone's able to have input on things that are going on. This also includes team nursing, and all individuals are able to perform several functions while reporting to several different leaders who may have the same power. Team nursing to me is very important. Everyone kind of works together to provide high quality, safe care to our patients. With team nursing, you're able to utilize the abilities of every member of the team to ensure the patient is appropriately taken care of. We're also all going to be working towards a common goal. That's very important. The vertical structure I was reading about also has some positive points in when you need quick answers or you don't have time to discuss with everybody. But overall, I really think that team nursing is appropriate to ensure to prevent employee burnout and to really just make sure our patients are taken care of. I hope you guys have a great rest of your week. Thanks for listening.